Hey, it's Jessica DeMassa with WTF Health. Joining me right now, I have Vivek Garipalli. He is the co-founder and CEO of Clover Health. Good to have you with us.
Thanks for having me.
So you're seeing a little bit more innovation in the Medicare Advantage space, and I think your company is one that has caught a lot of people's eyes. So tell me about, I guess, Clover, what you guys think you guys are doing so differently in connecting with Medicare patients as they're looking for a supplemental plan as they're getting older.
Great. Well, thanks for having me.
Sure.
So, the private Medicare Advantage space has been around for 20 years. And when we think about health insurance or any insurance product, it's, whether it's life insurance or auto insurance, or even most health insurance for let's call it the younger population, they're generally products that aren't utilized very often. So when we started Clover about, 6-7 years ago now, we didn't really think about insurance as the area we wanted to get into. We wanted to build a consumer product in healthcare, and really around improving health outcomes. And so when you think about what are the kind of the hallmark traits of a great consumer product, one, it's typically got to be something that people are engaged with frequently, and also view as a really important decision that they're making in terms of whether to use it or not. And so when we think about kind of the journey of healthcare, it's something that as you get older, it's something that you utilize a lot more frequently, and it's very top of mind. And that's why we made a decision to actually get into Medicare. And we thought the major opportunity was really around improving clinical decision making.
Okay.
So you hear a lot about, narrow networks of primary care physicians and so forth. And that makes sense, I think, in certain cases, but the real deficit or gap that exists in health outcomes improvement, especially around the elderly population, is actually presenting accurate data to physicians and actionable recommendations, all evidence-based around that is personalized around what is the right, for example, medication regimen for a particular patient, what diagnoses might be missed due to some lab results that aren't just easily determined via signs and symptoms. And you add all of these up, that those lead to excessive costs over time. Think about 15% of hospital admissions are driven by contraindication of medications in the Medicare population. And when we first started the company, we thought there'd be an opportunity to actually build software for insurers. Mm-hmm. We thought they looked at their market and they said, well, we have a customer for 8 years. Our customers are utilizing our product a lot. We assumed that at that point, this is now 2011, 2012, that clinical decision-making, which was where they were pouring all of their time and effort, not really.
Yeah.
And so we said, okay, if we're really serious about this, we can probably only do this successfully inside of our own insurance plan.
Why did you think that? Because that's like the obvious question, I guess, for me is just like, why clinical decision making? There's so much innovation happening around that. There are lots of little startups that are tackling just that. Why wrap a health plan around that? That's like one of the most difficult areas of this business. Why do it?
Yeah, so we didn't want to do it.
I don't think anybody wants to.
No, we really tried to determine, was there any other way we could be successful in our goal and not be the health plan. But when you think about actually partnering with a consumer and their physician, it starts with, can you get access to the longitudinal set of relevant information on that customer where you can actually be truly additive to that relationship? If you're not the plan, you really don't have reliable access to that information. Because we pay for every single service, including every single medication someone's on, as the primary health plan, that doesn't mean the access is easy. It doesn't mean the data is clean or easily formatable, but at least we can get access to it. Outside of that, it's very difficult because you're either paying to get access to data or you're getting access to intermittent information, and certainly not in a format where physicians are going to trust the source of that data. So that was one major component as to why we wanted to be the health plan. Two, when you think about what's kind of been missing in healthcare, it's alignment of interest. Mm-hmm. So a lot of the business models that have gotten created in healthcare over the last, call it 60, 70 years, it's driven by how dollars flow around. Hospitals generate more business value if they consolidate more market share because they can actually extract higher pricing. And if you can have the best mission, but if the way you generate business value is not actually aligned with that mission, you can't really create really good decision-making frameworks that drive towards that mission, because you're going to go out of business. So being the actual health plan where if we're actually able to manage care over the long term better, that's actually going to lower higher cost settings, whether it's emergency room visits or hospital admissions. And that value that gets created can actually be passed on to the consumer in the form of a lower cost product that actually creates more demand for it. And that alignment, generally speaking, doesn't exist in a lot of business models in healthcare.
Absolutely not. And so, I mean, listening to you, I'm thinking to myself, like, okay, great. Well, I mean, if you can do this with the Medicare population, could you then take the same kind of logic and apply it to an under 65 population, like for those kinds of health plans, or is that too difficult?
I think it's harder I think it's like from a psychological perspective. So and part of it's just kind of realities of math. I think you go back to the beginning of time, the average person is not able, or not even most people, almost all people, are not good at taking into account effects of short-term decisions on their long-term lives or health or whatever, right? It's not lost on people that nicotine addiction or smoking or drugs can have an impact long-term. Mm-hmm. But you live in the now, right. And that's kind of makes us who we are to some extent. And once you're older, there's certain realities that hit. And when you're 50, 55, 60, 65, 70, you get older, all of a sudden now you do have a chronic condition. Oh, I am pre-diabetic. Like that is something that I wasn't before.
Right.
And those realities of how health is now a primary focus of you, not just existentially, but in the now, all of a sudden causes you to look at health insurance, health care as a very important thing. And everyone kind of crosses that chasm at a different point in life. And, in Medicare, over 90% of costs are driven by chronic conditions. You're interacting with your physician much more frequently.
Yeah.
So there's a lever there where we're not having to convince our customer that healthcare is really important.
Yeah.
They're aware of that now. They've gotten to that point.
They learned their lesson.
They have an actual physician who has a relationship with them. So we can now empower that relationship with real actual differentiated data and information. But you go more down that age curve, below 50, below 45, there's a smaller minority now of individuals who maybe are at that level in terms of like really viewing healthcare as really important, mm-hmm. and taking a long view on that, and also having that relationship with a physician that has enough frequency where you can actually make that impact. Now, on the flip side, if you think about where can the biggest impact be made in the younger population, it's probably on government decision-making around, what foods are actually permitted to be served in schools. Because that's when you get, that kind of drives a lot of costs over time, mm-hmm. right? Is what foods do we get addicted to when we're young? Like, is it sugar or, carbs or vegetables, right? No one's born hating vegetables. Like but it's like you get this stuff wired. But think about the amount of costs that are created from age 60 to 90 because of what you ate when you're age 3 to 10.
Right.
That's where the biggest levers are. Or we think about, exercise, right? Or not smoking. Those things have much bigger levers on affecting long-term costs in terms of behaviors that you can adopt when you're in 20s, 30s, or 40s than what your health plan can do for you. So as much as I would love to say we have this ability in 15, 20, 25 years to have this massive impact on a population under the age of 40, I can't. At least I haven't thought of that idea yet. So the way I look at it is, we can help manage care when a consumer and the physician are well aware that it's important to manage it.
What's next for Clover? You guys have raised a ton of money, and throughout the time that you guys have been around, where are you at? Like 970 million, something like that's ridiculous. But so what are you looking at next? What are you looking to build out? You've built yourself you're managing the entire ecosystem from health plan, care delivery, interacting with patients. What's next? Are you looking to buy up any little chronic condition management companies? Are you trying to augment the tech platform that you've built? Looking for more ways to make use of the data? Give us a sense of where you're headed.
So I think our biggest progress for the last kind of year has been successfully being able to extend kind of all of our insights to physicians while they're seeing our patients. That's what's really created kind of the stepwise impact that we've been making recently. And for us, it's the more value we can drive through that. And our first area of focus around actual evidence-based recommendations has been around diabetes, but extending that into congestive heart failure, chronic obstructive pulmonary disease, associated comorbidities beyond that. That to us is where there's going to be huge value unlocked and on a compounding basis for physicians and their patients.
I love that you guys are looking at the physician as like the means by which to improve patient care. Like, I think that's just, it almost seems like the companies that I talk to, a lot of them will look at the patient, like, oh, we've got to focus on the patient and empowering the patient, and oftentimes the clinician is overlooked. Why did you guys decide to put your emphasis on clinical decision making and on the physician? It's unusual for a health plan.
I think patients generally trust their physician once they get to that level of utilization. There's a lot more skepticism about your physician when you're younger, when you don't really think you need your physician. But when it feels less of a commodity and you really do need someone who knows what they're talking about, so when we think about how do you tighten that relationship, is the way you improve that interaction from a reliability perspective is the physician's armed with all the information she or he needs. And if I think there's a lot of unintended consequences when you try to build a consumer relationship directly without the physician as an important fulcrum there. It's not helpful to the physician and what they're trying to do. And now there's definitely a segment of the population where maybe the existing primary care system can't service that population because they need multiple visits a month. Even then, it's not replaced by technology for us. It's replaced by our own primary care physician in a home-based model. So it's really around how do you empower that key accountable individual. No matter how we present ourselves, no one's going to say that because of my health plan, I'm not getting good decisions being made for me. Even though we view ourselves accountable around that, for us, it's, when we think about 2, 3, 4 years from now, if primary care physicians who have Clover members can legitimately say, and with all sorts of examples and evidence-based examples, that here are the 100 different ways Clover has helped me with my patient, that's where consumers start looking at a health plan as a plan they actually want to be with, because that's not how health plans market themselves today, unfortunately.
No, no, absolutely not. So, and part of me, I'm not getting any younger, so I'm looking forward to being able to sign on for a Clover membership. Thank you so much for joining us. It's a pleasure to talk with you. You guys have such a unique business model, and I'm really it's inspiring the way that you've looked at becoming the health plan as like the way to to gain access to the entire stream of data. I just think that's really, really cool.
Thank you.
Yeah, awesome. Thanks so much for joining us. I'm Jessica DeMassa with WTF Health. Thanks a lot.